Hello, hello, hello. Welcome to the Stella Woman Show, the magazine, and mainly the Stella Table Talks. We just want to know if you are able to see us right now in the studios. It's me, Stella Olivia Kikoyo, and Kim Vopni. So we are streaming right now on Facebook, LinkedIn, and Instagram. Just let us know where you are right now and if you can actually see us on any of those platforms: Facebook, LinkedIn, and Instagram. We would like to ensure that nobody misses any minute of this live stream. Okay, just send us a message and we'll be able to know that you can be able to see us. Yeah, fantastic, fantastic. Just we just want to confirm that we are streaming on all these platforms. Just send a hello Facebook, or hello LinkedIn, hello Instagram. We just want to know that we are live right now on all the different platforms. Just send a hello, and that will be enough to confirm to us as we start. Okay, I can see Facebook. I get to know. All right, so we are going to start. Thank you so much for those confirmations. Okay, hello, very good Facebook. Fantastic, fantastic. We can confirm that we are live. Okay, so yes, this is the Stella Table Talks, which is part of the Stella Woman magazine, and the Stella Woman magazine is here to really elevate women's consciousness for what is possible in them and for them. And we do this by using knowledge, because we believe knowledge is power, and we bring thriving women's stories, knowledge, and experiences so that you too can learn one or two things, make a change your perspective, reveal possibilities, and ensure that you can live your life to the fullest, really to the fullest, and actualize anything that you want to actualize in life. So yes, I am your host, Stella Olivia Kikoyo, and today we are here with our amazing Kim Vopni, and because we are covering women's health, it's Women's Health Edition, and this is Ask the Expert. This is where we have our expert who is here to answer all the different questions. And today we are covering pelvic floor and menopause. And the expert here is Kim Vopni, who is from Vancouver. Welcome, Kim.
Thank you so much for having me. Nice to be here.
Yes, I hear, Kim. They've just had some snow in Canada today. So if you're from Canada, if you're streaming from Canada right now, just wave to us. You'll have to know that we know what you're experiencing right now, and I hope you're just enjoying it and not feeling anything about it. So Kim is the founder of Pelvian and Vopni. She is a wellness coach, mainly focused on pelvic women's pelvic floor and menopause support, coach or practitioner, whatever you have. And what we're calling for you today in our participation is to send any comment, any query, but mainly your questions. We know these are subjects that we as women don't exactly openly talk about, and we end up suffering in silence, and this is not what we want to do. In the Stella Woman magazine, we want women to thrive. We want women to actualize and really live full lives. So welcome, Kim, and please let our audience know more about you.
Thank you, Stella. So my name is Kim Vopni. I'm known as the Vagina Coach, and I use fitness and lifestyle education to help women prevent and overcome pelvic floor challenges like incontinence and organ prolapse and painful sex, so that they can age powerfully. And I got into this line of work initially with pregnant women, then I started supporting more postpartum. And as I was going through my own perimenopause, menopause transition, I started to expand the kind of the reach, if you can say that, to include perimenopause and postmenopause women, because it's not just do your Kegels in pregnancy or here's what you need to do to recover from pregnancy and birth, because there are women who struggle who have never been pregnant or given birth at any point in their life. And anybody who is reaching midlife, we're all going through the hormonal changes of menopause that influence all parts of our body and definitely the pelvic floor as well.
Oh, fantastic. That's a broad area, and but yet a very significant areas for women like myself, definitely when it comes to premenopause, postmenopause, whatever it is that we are going to experience. It's time for us. Sometimes we wait until we are in the situation rather than actually knowing that we need to learn all of this before we get there. But with all of that expert knowledge, we want to first focus on the aspect of the pelvic floor. So I know that I had actually someone ask that question, but I too, as I have told you before, I only got to know about that key area of my life when I was expecting my first child. Tell us what gets wrong. Why does this happen in the whole system that we have this key area in our lives, but only we just become aware of it when we are in situations like expecting a child?
Our medical systems are not set up for preventive health. They're very much a reactionary system. And so in pregnancy, some people will start to experience some pelvic floor challenges. Other people, it's after birth that they may experience some sort of challenges. I'm sorry, I'm trying to stop the ding on my phone. That it's simply not education that's provided to us at any point in our life. And so it's usually only once a problem exists that people learn about what the pelvic floor is. And then there's a lot of people who feel quite angry and resentful that they now wish someone had told them earlier, because they probably could have intervened and potentially reduced or eliminated the challenges that they're now having.
Oh, yeah. So it's so much about the fact that the system is not set for these preventive issues.
Right.
Is it even up to today?
Yep.
Oh, that is not something I would expect. I thought things most likely have changed for the younger generation.
I think that social media has played a role in helping get education out. So I think there are people who are more informed, but you need to know what practitioners to seek out, because again, this is no disrespect to the medical system. It's their training is reactive. Their training is in pharmaceuticals and surgery to fix a problem that exists, but they're not trained in necessarily the preventive aspect. And not everybody knows. We just don't think, because that's how we have been kind of raised. So now things are starting to shift. And as awareness has been increased with social media, there's more people seeking out different opinions and other healthcare practitioners. But that can be a challenge. If you don't know to do that, then you are still dealing with the reactionary system.
Oh, okay. Wow, wow. So that's an aspect that we all have to really understand for sure, for sure. And when you look at it, we are fortunate that at least we are able to tap into the knowledge. And you talk about social media, and this is how I met you as I started to think about our issues as women and how to ensure that we spread this knowledge across the globe. I got hold of you because you are so generous. You are giving out all your expert knowledge, are helping women to really change, improve their lives. And we tap into that knowledge that you have. And we're so grateful that we are able to share, to get your knowledge and be able to spread it to others. And that's why you talk about the aspect of social media. And yeah, we have to be grateful. And we are streaming right now because of social media. You are all able, as people who are viewing this, you are able to tap into this knowledge right now. So what we are asking you is to actually send us any questions that you have when it comes to pelvic floor, that you have questions that you have for Kim, or when it comes to menopause, although we are going to first focus on pelvic floor, but you can bring all your questions no matter what area that wherever you are streaming from. And it could be an issue that is not to do with you, but it could be with someone that you know, someone you care about. So don't worry about that. Just bring in your questions. So Kim, let's continue about this. Just asking you, what are some of the factors that bring about weaknesses in the pelvic floor?
There's lots of different contributing factors, and I think the word weakness is also something I want to clarify, because people assume that if they have incontinence or if they have organ prolapse, that must mean their muscles are weak, and they interpret weakness as laxity. But we can have tight muscles that are weak. So I just wanted to plant the seed of the word weakness is sometimes misinterpreted, maybe. But incontinence is very common. This is where there's several different types. So potentially laughing, coughing, sneezing, jumping, exercise. We have a little bit of urine that leaks out. This is called stress urinary incontinence. And that's the one that we often will see the pad companies advertising to us on TV. And they tell us it's just part of being a woman, or that we might have heard from a care provider that that's just what happens as you get older or happens as you hit menopause. Urge incontinence is where we have we're fine, but then all of a sudden something triggers us and we have an overwhelming urge to need to get to the bathroom, and we might leak a little bit, or we might have a complete release of the bladder. We can have the combination of the two, stress urinary incontinence and urge, which would be called mixed. You can have anal incontinence where gas or stool leak out, which is much less common, but much more life altering. And so those are, multifaceted in terms of what contributes. It can be tight muscles. It can be poor coordination. It can be poor posture. It can be constipation. It can be bladder irritants. It can be dehydration. It could be low estrogen. So it's really important to work with somebody who understands how to help you do the root cause investigation and then address one or all of the root causes that may exist for overcoming those. And as I mentioned, tight muscles. So tight muscles, we think tight is better, but tight muscles are also weak and they don't have good blood flow and circulation. And more, when I'm asking my pelvic floor physical therapist colleagues, they're finding that more and more people who are coming to them are dealing with excess tension in the pelvic floor. So we need to work on releasing and relaxing that. And that seems counterintuitive to people because they think, well, I'm leaking urine or I have organ prolapse, for instance, and they feel like, how could that be that I would need to release? I feel like I need to strengthen, and they interpret strength as tight.
Oh, okay. That would have been my interpretation as well. So I'm grateful that you actually focused on ensuring that we get to understand what that means, and you're helping to demystify some of the myths that we could have or misconceptions on some of these subjects. Very good. Could you highlight these experts? Are they just pelvic floor therapists, or is there another terminology just in case in other areas they call them differently? I don't know in terms of the.
I always recommend that pelvic floor physical therapists so in the United States, they're called physical therapists. In Canada, in the UK, and many other parts of the world, it's physiotherapy. It's the same profession. It's just named slightly. So somebody who is a trained physiotherapist or physical therapist who has additional training in the pelvic floor is who you would want to see. And these, in my opinion, this is our best first line of defense. So anything that feels off or weird or you're unsure about as it pertains to the pelvic floor, I would see a pelvic floor physical therapist first, and then they can help you screen and decide if it's something medical, and then you can go off to see your doctor. And I do believe that we would benefit from seeing a pelvic floor physical therapist once a year, even if we had no symptoms. So especially if you do have symptoms, but even if you have no symptoms at all, kind of like we see the dentist if we don't have any toothache or sensitivities, we just go for our checkup. I think we should be doing the same thing for the pelvic floor.
Okay, yeah, that's good guidance. Thank you so much for highlighting that. So when it comes to some of the exercises that we have in the Vopni, for example, what how can people get access to these exercises? Yes.
Yeah, and I see somebody's asking a question, does pelvic floor exercise help women to overcome incontinence? Yes, absolutely. So definitely stress urinary incontinence, pelvic floor muscle training or pelvic floor exercise is an important part of that, as can be overcoming urge incontinence, as can be overcoming anal incontinence. You want to, though, again, understand what are the mechanisms of what's contributing to that happening in the first place, and then we tailor the exercise. Maybe we need more release work, more lengthening of the pelvic floor, more breath work, more down regulation of the nervous system. For the people who have overactivity, maybe the people who do have laxity, now that's when we need to add in the strength and the endurance component. But the limiting factor when people think of pelvic floor exercise, they think of Kegels. And I don't want to take away from the fact that Kegel exercises absolutely do work. Dr. Kegel was the one who invented them. It's a voluntary activation, like contract, lift, and let go of the pelvic floor. And they are evidence-based, but they don't train the pelvic floor dynamically. And so my bias and my approach is to incorporate the pelvic floor into whole body movement. So we go to the gym and we lift weights, we run, we do all these things. And if we can train the pelvic floor to respond to dynamic movement, loading, resistance training, all the things that we do, even activities of daily living, that's more functional. Doing Kegels, which most people interpret as doing while you brush your teeth or do while you sit in the car at a red light, that's not really going to translate into helping you lift weights at the gym or lift your grandchildren up or help prevent help prevent leaks when you're laughing or coughing or sneezing.
Yeah. Oh, very good. That was a good way for us to be able to understand more about what we're supposed to be doing beyond just the Kegels. Thank you very much. This is at the point where you ask the expert. And thank you so much for all of you who are sending in your questions. Please keep them coming. It's all about women's health, and we would like to respond to them. I think most of them are coming from Facebook. I don't know yet whether we have some few questions from LinkedIn, but I did have some questions that came in before. All right, have we changed the look? I think is that Instagram look. Okay. Let's just see one. Is 4 years post C-section too late to start?
Sorry, can you repeat that one?
It's just so short. Is 4 years post the C-section?
So somebody who's post C-section,
yes,
a lot of people think that if they've had a cesarean birth, that their pelvic floor is fine and they don't need to do pelvic floor muscle training. I argue that even people who have never been pregnant still benefit from pelvic floor muscle training. And I can also argue that people who've had a cesarean birth may actually be even at an increased risk of being disadvantaged post birth because of they've had the same postural changes, they've had the same postural adaptations, hormonal adaptations. Then they've had a surgical intervention that has cut through many different layers within the abdomen, leaving multiple layers of scar tissue that can interfere with function. So even if you've had a cesarean birth, I do recommend you see a pelvic floor physiotherapist or physical therapist, and that you also establish a good pelvic floor muscle training routine as well.
All right. We do have that's very good. Kim, thank you so much. We have Omel asking, yes, I did cardio exercises most of the time. Are there other exercises I should do?
So yeah, as I was saying, Kegel exercises are evidence-based, but we want to expand upon that and train the pelvic floor dynamically. So when you can bring your Kegels into lunges and squats and bridges and bicep curls and push-ups and all the things, it's becoming more functional, and we're training the pelvic floor to not just be able to contract and lift while we're sitting or while we're standing brushing our teeth. We want it to manage all of the different things that we do. So I'm a big fan of bringing your Kegels into whole body movement. I'm also a big fan of a practice called hypopressives. It's also called low pressure fitness.
Hypo? Can you say that?
Hypopressive.
Pressive.
Yes.
Okay. Can you elaborate on that? What does that mean?
So the term hypopressive means low pressure. And a lot of times, I mean, lots of things we do in a day increase our intra-abdominal pressure. So intra-abdominal pressure is something that we all have, we all need. It's part of our core control mechanisms. And it's not bad, but if we aren't able, we don't have a pelvic floor that is able to withstand increases in intra-abdominal pressure, we might leak, we might experience prolapse, we might have hernias. Standing up from a chair increases intra-abdominal pressure. So again, it happens all throughout the day with all sorts of things that we're doing. We need the pelvic floor to be trained to manage those pressures. Hypopressives is a postural practice, a breathwork practice that helps the body adapt and become better at managing pressure. When we do what I call buff muff exercises, kind of the whole body pelvic floor muscle training, that is what's helping us kind of create that good foundation. Hypopressives helps almost lift. There's a change in position of the internal organs with the practice itself that can help alleviate, especially people who have any organs that are descending, which is pelvic organ prolapse. So the two together are kind of like peanut butter and jelly. I think they go best together. Not doing them at the exact same time, but as part of your overall fitness routine, I think they are immensely helpful, not just for the pelvic floor, but definitely when we have a pelvic floor that works well, all of the other things that we want to do are easier and better, and we're stronger.
Okay, that's very good. Thank you so much, Omel, for that lovely question. And thank you, Kim, for the response. So this is so much of a lifestyle aspect. So we are
Yeah.
changing how we do things with all these exercises put in different situations of
Yeah,
our
a lot of
lives.
people think of pelvic floor as they only need to do them if they have a problem that they need to fix.
Yeah.
And I argue we really should learn about this much earlier in life, and we should be doing them through our whole life to prevent the challenges. So that's yeah, absolutely a lifestyle approach.
Oh, fantastic. That's so good. It's an alert. I'm just like my whole awareness is like, okay, Kim is talking to you right now. It's very good. And here we have Rachel. What can I do to keep the pelvic area strong as I age? Okay.
So there's when I'm teaching, I use an acronym called ABC. So A is for our alignment. So we want to make sure that our diaphragm is over our pelvic floor. So our ribs are over our pelvis.
Yeah.
And when we are more aligned, the relationship between the diaphragm and the pelvic floor works better. So you want to pay attention to your alignment, and that then is kind of how we hold ourselves. Like, what's our posture through the day? Because if we're standing or sitting slouched all the time, that can contribute to non-optimal alignment. Oftentimes what I see, especially in people who have been pregnant, is very tight hamstrings and calves, a posteriorly tilted pelvis, a rounded upper back, weak core on the front side, tight chest. So we want to lengthen the areas that are tight, strengthen the areas that are kind of weakened, and try to bring ourselves more into balance, more into the alignment. Then we want to work on reconnecting our mind body, the breath with the pelvic floor. And I do that with different visualization, different cueing, because the pelvic floor is inside our body. We can't see it. We can see our external genitalia, but we can't go to the mirror and look at what our pelvic floor muscles are doing. So we want to connect with different visualizations. And then we want to, once we've worked on our alignment, we've got our breath under control. Now we want to coordinate it into movement, like I was saying earlier. So squats, lunges, bicep curls, push-ups, to make it more functional, even into our whole body, into our activities of daily living. So that's kind of the fundamentals, and from an exercise perspective. Then as we are also moving through different ages and stages, especially once we are approaching our menopause, we have the hormonal piece. We go through hormonal fluctuations while we are cycling. And just before our periods, we are in a low estrogen state. And a lot of people will say, I leak more, or I feel heaviness in my pelvis. I feel not as strong just before my period. And that is a low estrogen state, and that's kind of giving you a glimpse into what happens once we reach menopause and we are in forever a low estrogen state. So using a vaginal moisturizer while we're younger and then adding on vaginal estrogen once we reach our menopause and continuing those practices for the rest of our lives. Also using a lubricant during sexual activity, and that could be with or without a partner. Avoiding constipation. Constipation is a huge contributor to pelvic floor dysfunction. So you want to make sure that you're pooping well every single day and not straining.
Yeah.
You also want to make sure that you're hydrated. A lot of people who deal with pelvic floor challenges will often restrict their fluids with the intention of not leaking or not having urgency. But if we don't drink, then we have very concentrated urine. It irritates the bladder. It's going to signal you more urgently, more frequently. So you end up creating a different problem. So those are a couple of the top tips that I would recommend.
Oh, those are great. Thank you so much. Thank you. And yes, we love you too, Hilda. Thank you for that. And Mel says she has been following you. And I also got someone else who said they've been following you and they love your program, Kim. So
Thank
that
you.
is so wonderful, wonderful. Your work is amazing. You're really, really helping, yes, lots of women. And once you help women really, once women are comfortable, are happy, they are going to just be able to support whoever is around them. And the way you explain the pelvic floor in terms of supporting everything else in your life, it's something that becomes really important. But how important do people know this? And what do you think? Do really people know how important the pelvic floor is in supporting everything else?
I think it's starting to shift a little bit, but in general, no. We, like I said, we just have never been told anything about the pelvic floor. We don't, I had never heard the term until after my first child was born. And that's usually when people start to learn, is when there's a problem or something existing that they need to fix. So I don't think that there's enough awareness. I don't think that again, the medical system is set up to work preventively. We have very short visits. It's usually trying to screen out life-threatening conditions. And often things like pelvic floor dysfunction is either not discussed at all or is dismissed as being normal as you're aging. So I think there's a lot of barriers to access to this information and access to care. And my hope is that with what I'm doing with sharing on social media and what have you, is to give women education, awareness, and for them to be able to then advocate, because a lot they can do on their own. But if they do need to seek the care of a provider, they know what questions to ask. They know how to advocate for themselves. They also know that there's pelvic floor physical therapy that would be their best first line of defense. So I hope that with the next generation that it is something that they all know about and it's just part of their life. We're not quite there yet.
Yeah, that's what I hope for as well. And with the work that you're doing, the more we become aware, the more we support the next generation so
Yeah,
that they
exactly.
are more informed individuals, women in that regard. Oh,
Yeah.
thank you so much. I know you can go on, Kim, every time I go on your Instagram, especially, I'm always just like, now that's new. Now that's new. Now that's new. Now, where does this stop? I'm just always, in a way, in terms of how much we have to learn and to do. Now, what are some of the easiest masters? Like easiest masters that women who feel like, oh no, I don't even have time for pelvic floor exercise. I don't really have the time. What do they have to ensure that they do with their lives?
I always think of to people who say that, I always think of, if you don't make time for your wellness, you're going to make time for your illness. And when you experience pelvic floor challenges, all of a sudden, everything else in your life is you either not doing it or you're not doing it as enjoyably, you're not as present. So by investing in it doesn't take a ton of time. It can be 10 minutes of exercise for your pelvic floor that also is going to address your whole body.
Yeah.
It is really all that it takes. So I look at it as I know statistically, I think it's 40 from the research, 46% of women stop exercise because of their pelvic floor. And that then increases our risks of cardiovascular disease, metabolic disease, osteoporosis. And then if you think about from a menopause perspective, in the first 5 years post-menopause, we lose 10% of our bone mass. So if we are not exercising leading up to that, plus we continue to not exercise, we are then at significant risk of developing osteoporosis. That's our skeleton. And when we have, yes, you can reverse osteoporosis, but it's a big challenge. Let's not let ourselves get there. Let's work at optimizing our skeleton, our muscles, our pelvic floor, so that we can do all the things. So a big part of my messaging that is shifting now is this is crucial to our longevity.
Yeah.
If we are not optimizing, we are not taking that 10 minutes a day to pay attention to our pelvic floor, we have a whole host of other health conditions that are going to require a whole heck of a lot of effort and time. And, you know, you could argue people are going to be put on medications. They're not going to be socializing. They're not going to be exercising. They're not going to be intimate with their partners. They're right. So it just becomes this, it's so important. I just can't say that enough. Take that 10 minutes. You should be at the top of your to-do list with your pelvic floor.
Yeah.
Get it off the list, and all of the other things on your to-do list that you do make time for will become easier.
Oh, fantastic. 10 minutes, 10 minutes a day. And I like the fact that you've told us if we don't make time for our wellness, we'll make then time for our illness.
You'll be forced to. Yeah.
Yes. And this is where you have to choose. And I'm sure that everyone is wise enough to choose to get 10 minutes and allocate it to your pelvic floor and make everything else possible for your life. Fantastic. I know that we are running out of time, but let's go a little bit to menopause. There are lots of, what are some of the biggest myths that you can help right now women stop believing about menopause?
That what they're dealing with is normal, that what they're dealing with is something that's just part of getting older, that they need to wear pads for the rest of their life, that they need surgery or drugs to fix their problem. So those are all very common. And as I mentioned, the transition to menopause brings on that permanent low estrogen state, unless somebody is supplementing with estrogen hormone therapy. And so there's a whole umbrella term called genitourinary syndrome of menopause. And we have genital symptoms, urinary symptoms, sexual symptoms. And 50 to 80% of women will experience one or more of those symptoms under that umbrella term of GSM. And they are not symptoms that get better with time like hot flashes do. And so again, knowing statistically how many women it will affect, and it's things like painful sex, urinary urgency, frequency, overactive bladder, stress incontinence, increased risk of UTIs, shrinking labia, clitoral adhesions, like significant changes that we can prevent. We can prevent with early intervention with vaginal estrogen. And I feel like I'm kind of screaming from the rooftops that vaginal estrogen I consider to be like an essential nutrient. In the UK, it is available over the counter, which it should be globally. We shouldn't need a prescription for this. But right now we do. So if you're listening to this and you are at or post menopause, speak to your care provider and ask them for local vaginal estrogen. Cream is my favorite because you can apply externally and internally, because we need to address both internal and external tissues. That can solve so many problems. It can help with, again, all of those symptoms that we were just talking about. Not taking away the fact that, yes, we still benefit from exercise, but there was also a recent study that looked at vaginal estrogen in the form of vaginal estriol and Kegels. So they took the two together, and that was more effective than Kegels alone. So if there's one thing that you do in this post-menopause transition, there's systemic hormone therapy, which I am also a fan of based on all the evidence. We have more favorable health outcomes with bioidentical hormone replacement therapy. Our vaginas also benefit, and we can use both systemic hormone therapy and vaginal hormone therapy.
Oh, fantastic. Wow. Wow. That's a lot to take in. And I think what you've said, what you have to shout on over your rooftop is the vaginal estrogen. Is that the case?
Yes.
And you said cream is your best option that you can.
Yeah, you can use cream. You can use a tablet that's inserted into the vagina. There's also a little ring pessary. So you can choose your favorite delivery mode, but it is important that the external tissues also receive some estrogen. So that's the benefit of cream.
Okay, fantastic. Thank you so much. Thank you for that. I hope you've been able to gain whoever is viewing us. Those on LinkedIn, Instagram, we're not able to tap into some of the questions. We are mostly focused. A lot of them are coming from Facebook, but we do have some of them that came in earlier. I did have one that I thought would be of benefit. Yes, this is to do with weight. How does menopause affect metabolism, and what can women do to maintain their healthy weight?
So I'm not a weight loss expert. I'm not a nutrition expert, but I can tell you that the hormonal shift is a big part of the overall changes to our body composition, especially in the women who have stopped exercising. So in general, we are usually moving less. Some women are not lifting heavy weight. We're losing, as I said, we lose bone mass, we lose muscle mass, and so the ratio of fat-free mass is changing. We start to accumulate more fat around the middle. It's almost like our body's way of trying to create an additional estrogen source. So one form of estrogen called estrone. It's there's three main types: E1, E2, E3. E1 is estrone. It's produced primarily from our fat tissues. So it's almost like the body trying to create an additional estrogen source when we are in this low estrogen state. We become more insulin resistant in that low estrogen state. So the way that we are managing blood sugar is challenging as well. So for recommendations, eat more protein, eat at least 1 gram of protein per pound of ideal body weight. Eat your protein first during your meal. Prioritize about 30 to 40 grams of good high quality. Usually that means animal product protein at every meal. Reducing the like processed food sugar. I think hopefully most people realize that's not favorable. We want to reduce that. But the carbohydrates you choose, we want to choose high fiber, but or fibrous vegetables, but leafy greens, kind of more of the green vegetables, some fruit as well. But paying attention to our blood sugar management is really important. And also our cortisol. So cortisol is another, it's basically going to help contribute to fat storage. And it's a stressful time. Usually we're a sandwich generation. We have work demands, we have relationship demands, we have children, we have aging parents, and menopause itself is a stressor because we get the doom and gloom. And so we have this poor cortisol management, which is going to contribute to more fat storage. So those are a couple of strategies and also a couple of the reasons why we may be gaining more weight.
Okay, that's so good. So we have to maybe what I could easily take away for the rest of us is increase our protein take and take that fast. Take that, eat that fast.
Eat it first, yes.
And also, of course, thinking about the processed foods and reducing the sugar intake as well.
Yeah.
So yes, so that is so awesome, Kim. Thank you so much. What is one takeaway for issues to do with menopause? Anything that you think, okay, Stella, you haven't asked me this, but I need to put this in for the audience, for everyone who has been listening.
I would say
and watching us.
Yeah, I would say read the book Estrogen Matters. It's a very evidence-based look at the importance of hormones in general, but particularly estrogen, that received a bad rap from the Women's Health Initiative. So this paints a very clear picture of what the evidence truly said compared to what was misrepresented in the media and scared everybody. So I think it's a very, very important read for all women, ideally before they reach their menopause. We know that menopause hormone therapy has the best it's most beneficial when started as close to the start of your menopause as possible. Not meaning that you can't benefit later on, but we benefit from this information again earlier in life so that we can step in and intervene rather than waiting for there to be a problem to overcome.
Okay, thank you very much. So does it have a particular author?
Dr. Avram Bluming, Bluming, and Dr. Carol Tavris, Tavris.
Okay, that's Estrogen Matters.
Correct.
Yeah, fantastic, fantastic. Kim, it has been awesome really having you today on our stream, and I hope everybody has been able to enjoy and tap into Kim's knowledge, her experiences, that have led her to be able to guide all of us. And we are so grateful on the Stella Woman magazine that we tap into your knowledge and share it with women across the globe. I know that you can always get some of Kim's knowledge into the Stella Woman magazine, but Kim is also here. Some of you have already acknowledged that you already follow her, and if you're on the back map, I'm not so sure. But Kim, tell us, how can people find you and tap into this knowledge beyond the
My
Stella Woman
website,
magazine?
yeah, my website is vaginacoach.com, and social media handles are all at vaginacoach. So basically, if you go to Google and put vagina coach in, you'll find me somewhere.
Yes, Vagina Coach. So that is great. Thank you so much, Kim.
You're welcome.
And
Thanks for having
thank
me.
you, everyone, for really being here with us. And thank you for the lovely, lovely questions. Keep them coming. We'll be able to tap into them and send them over to Kim to be able to answer them. And we'll be able to send them to you. So do not be afraid. Just keep your questions. Send them to the Stella Woman magazine. You can send them to Stella at stellawomanmag.com. This is where we can be able to send them to Kim, or you can always follow Kim Vagina Coach and on Instagram and on anywhere. Just Google that. Just Google that. It is simple for you to find Kim. Awesome, awesome, awesome. So until next time, thank you so much, Kim. And thank you everyone for tuning in with us. It has been me, Stella Kikoyo, your host on the Stella Table Talks. So until next time, it's Women's Health. Ask your expert. And today's expert was Kim Vopni. Bye-bye for now.
Thank you.